reality of aging. Welcome to SBH Bronx Health Talk, produced by SBH Health System and broadcast from St. Barnabas Hospital in the Bronx. I'm Stephen Clark. Cataracts develop when the lens in your eye becomes cloudy. The lens focuses the light so your brain and eye work together to process information. When you have a cataract, the eye can't focus light in the same way. Like thinning hair, wrinkles, gum recession, and an overactive bladder, cataracts are one of the pleasantries that come with getting older. Yet in some cases, cataracts may form years before they affect your eyesight and need to be removed. With us today to discuss cataracts is Dr. Michelle Packles, an ophthalmologist at SBH. Welcome, Dr. Packles.
Thank you.
So let's start out. If you live long enough, are you going to get cataracts?
Everybody develops cataracts. It's a natural part of aging.
Okay.
It's not a disease.
So when is it time to have a cataract removed?
I mean, cataracts form in older age, usually, unless a patient's had trauma or takes certain medications. But the time to have a cataract removed is once it becomes visually significant or has visually significant symptoms, like a truck driver has significant glare and can't do his job, stuff like that.
Do typically people come to you and say, my vision is cloudy, or during an exam, do you say, you have a cataract?
Either one. I mean, a lot of people come in and say they can't see small letters, can't see big letters, have trouble recognizing faces or seeing stairs or curbs well. Some people even fall. It's very dangerous if a cataract develops and the patient can't see well, especially if he or she is elderly and falls and breaks a hip. So it's advisable to see the ophthalmologist to evaluate whether the cataract is causing diminished vision.
Are there certain risk factors, Dr. Packles, that would lead to someone getting cataracts earlier in their life rather than later?
Yeah, steroid use, trauma, the use of even glaucoma medications.
And if everyone eventually gets cataracts, if they live long enough, do some people avoid the need to have them surgically removed? Will some just find it's really not asymptomatic and they can live with it?
Up to a certain point, but eventually all cataracts need to be removed because so I always make the analogy that a lens is composed of rings, kind of like the bark of a tree. And as the lens ages, just like a tree ages, the tree forms the rings on the outside and pushes the older rings more interior. The lens ages in the same way, whereas the older cells form these rings around the outer part of the lens. So the inner part of the lens becomes thicker and thicker. It doesn't go away, it just thickens. So as the years pass, the center of the lens becomes thicker, diminishing the vision and eventually, preventing vision if you wait long enough. It's better not to wait until the lens becomes hard because more energy is required to remove the cataract from the eye. It's better to wait until the cataract is about mid-thickness, vision 2040, 2050, 2060, 2070. That's the best time to remove the cataract. We do get in this population, we get a lot of cataracts that are physically harder, and it can be done. It's just more energy is required to remove it. And during cataract surgery, the entire eye absorbs the energy. So there'll be less energy required to remove a softer cataract.
But by the same token, I guess you don't want to remove the cataract too early, right?
Yeah, correct. That's why we, I don't have my lenses removed yet. I'm too young and my lenses are soft. I'm not seeing like I used to when I was 20 years old, but still I'm seeing very, very well. It's the same thing with everyone else. The vision over the years diminishes very, very slowly. First, it's the vision at distance. We may get slightly better near vision, but eventually, distant sight, intermediate sight, and near sight are all affected.
So, what is the surgery for cataracts like? How long is it? Is it a significant procedure? Tell us a little bit about it.
So the procedure is definitely a significant procedure. It's not a minor procedure. It's done in the operating room under sterile conditions. And it's an intraocular procedure. The cataract has to be broken up and removed, and a synthetic lens is implanted that never develops another cataract. It's not a long procedure, but it's definitely not a minor procedure.
Okay, and typically after the procedure, what's the recuperation time? How soon before that individual is seeing well again?
Vision can be restored next day. A patch is put on the eye. Patients come to the clinic the next day, the patch is removed, and oftentimes it's a celebratory day where everyone is very happy and vision is restored. For instance, I operated yesterday. I had a patient who had hand motion vision from a cataract, and today she had 20/25 vision. She was in tears. She was so happy. So that's often the case. It's a miraculous, the modern day miracle that we're able to remove cataracts and restore vision so quickly.
Did you find, you mentioned it's long distance vision versus up close vision, but do people after having their cataracts removed, will they need a new prescription if they wear glasses or contact lenses or something like that?
Well, first of all, cataracts diminish vision at distance, at intermediate vision, and also at near vision. In the earlier stages of a cataract, the eye can become more nearsighted at first. So it's called a second sight, where the vision at distance is blurry, but the patient becomes a little more nearsighted at first and then sees better at near. But eventually, as the cataract continues to progress, the vision at distance, the vision at near also diminishes. Regarding the prescription of the eye, the prescription of the eye completely changes because the lens is part of the system of the eye that creates the prescription. So when the natural lens is removed and a new lens is put in, the prescription changes. Good distance vision, usually here, good distance vision is the goal. So intermediate vision and near vision automatically needs reading glasses. But there are options for what we call specialty lenses, where there's new technology where lenses are implanted that offer good distance vision in combination with good near vision, or intermediate vision, and possibly with near vision. Lenses that are implanted can also correct for certain degrees of astigmatism. So instead of wearing glasses after the surgery for astigmatism, which is usually not corrected during cataract surgery, these new specialty lenses can correct for astigmatism inside the eye, so the patient won't have to wear glasses. So those are wonderful options.
If you have a cataract removed, does it grow back?
No.
So that's it. It's a one-time deal per eye. Once you have it removed, you're good to go forever.
Yes, and it's a relatively quick procedure.
How long is it typically?
15 to 30 minutes.
Is the patient under local?
Yes, but sedated, very relaxed.
Okay.
Yeah.
Okay. Right. Okay. If a person had LASIK procedure done earlier, are they still a candidate to have a cataract removed?
Yes. I mean, the measurements become a little more complicated for what lens to implant, but yes, of course.
Is that the most common procedure you're doing typically? Cataract removal?
I do a lot of different kinds of procedure. I do the cataract surgery. I do pterygium surgery. I do incisional glaucoma surgery. I do all the trauma that enters this hospital, but cataract surgery is definitely the most common because everybody develops it. Not everybody develops a pterygium or needs incisional glaucoma surgery or has trauma requiring surgical repair, but everyone eventually needs cataracts removed.
What's pterygium?
A pterygium is a growth of the conjunctiva and what's called the Tenon fascia next to the cornea that crosses the border onto the cornea and grows onto the cornea. It can cause visual changes. It can cause astigmatism, and it happens in dry inflamed eyes in people who come from tropical areas. So we have a lot of people coming from Latin America, from Africa, that are exposed to a lot of sun, don't wear sunglasses, don't wear the wide-brimmed hats, and they come here and they have these growths, and some people are candidates for surgical removal.
Are these growths? Can you see the growths? I mean, not you, but could I see them? They're obvious.
A lot of my patients who have pterygia are young patients who are very self-conscious of how they appear. it causes a lot of depression and anxiety, and these surgeries are wonderful for those patients. The patients are very, very happy afterwards.
Okay, that's interesting. Now, also, yeah. it's a full service department, the ophthalmology department. You also have an optical store as well, right?
Yeah, we have an optical shop here. So after prescription for glasses is given, patients can go and get glasses here.
Okay, and you have an optometrist who actually will do vision checks and stuff in addition to the ophthalmologist?
We have 3 optometrists here. Yeah.
Okay. If someone wanted to make an appointment, is there a phone number they could call?
718-960-6127.
Okay, very good. And again, if they have a cataract or a need for surgery relatively quickly, you can get them an appointment?
Yes, absolutely.
Okay. Well, Dr. Packles, thank you very much for a few minutes today. This was very interesting. If someone is concerned about cataracts or their eye health in general, please give Dr. Packles a call.
One more thing I just want to say. I'm fluent in Spanish, so all the Spanish-speaking patients can come and feel very comfortable speaking in their native tongue.
Why don't you say that in Spanish?
Hablo español y es posible que todos los pacientes que hablan español vengan para estar atendidos aquí.
Okay, Dr. Packles, thank you for some time today. And for more information on services at SBH, visit www.sbhny.org. Until next time.